Now, for those of you who may not be familiar, I just want to give you a little bit of a rundown of what we are talking about today and how this differs for women of color. Now, the average age for menopause, and when I say menopause, I mean having had your last period, and that's confirmed a year later. So we know for sure you've had the last one. The average age for that is about 51 and a half. For African American women, menopause tends to start earlier, almost a full year earlier than for white and the general population. African American women also have more symptoms. The symptoms are more severe and last longer. And that transition, which is the period of time between when your periods have started to change, and this is also called perimenopause, this can go on for as long as 10 years. So the traditional symptoms that we talk about, hot flashes, mood swings, sleeplessness, and the other 30 plus symptoms of menopause, just know that with studies that would have been following women longitudinally, we have found that this hits really differently for Black women. Now, in addition to that, and I think what is more disturbing is that even though Black women are often more symptomatic, they are least likely to complain of these symptoms to their doctor. And when they do complain to their doctor, they are only half as likely to get a prescription and get relief for their menopausal symptoms. And I want this conversation to really focus on menopause and also some of the longer term health implications of what happens at menopause. And that's why it's so important we have Dr. Jayne Morgan here, who is a cardiologist. And what I'd really like to set up for you is the fact that menopause is also a time when your cardiovascular risk goes up. Prior to menopause, women have about half the risk of heart disease that men do. But then something happens at menopause. And I'd like to ask Dr. Morgan to please explain to our viewers, what are those risk factors and what happens to women at menopause?
Thanks so much, Sharon, for having me today. And this is such a sage and timely conversation, not just for Juneteenth, but for us to understand really what is the interaction of our hormones and our heart, because we don't often think about them, and not just that connection for Black women and Black America, but really for all women. What is this connection? We certainly suffer more, but we need to understand what these hormones mean. When we look at the heart and we look at the progression of heart disease, we are beginning to understand that a lot of that has to do with inflammation. And you may or may not have heard about that. So inflammatory processes that occur inside of your arteries. We now are beginning to understand that estrogen actually has anti-inflammatory properties. And so what happens during menopause is your estrogen levels begin to decrease and continue to drop and drop and drop. That is why your risk of a heart attack or some type of heart event tends to equal that of men on the other side of menopause than prior to menopause, when your risk was a lot lower. That's why Sharon and I thought it would be great if the two of us got together to really have this discussion of what is the significance of this transition in a woman's life and what we need to do to empower ourselves to make certain that we can understand and advocate. Because as Sharon well knows, many physicians are also not familiar with this transition in a woman's life. And in fact, when we looked at a recent survey, only 26% of primary care physicians were comfortable managing a woman's heart symptoms. And if you can believe this, only 42% of cardiologists were comfortable managing a woman's heart symptoms, mostly because, if you think about it practically, most cardiologists are men. And we still, in this society and within our culture, have a very high tolerance for the suffering of women and the suffering of minority populations. Our tolerance for that is high. And so your symptoms are more likely to be minimized or attributed to other things.